One Zambia, one nation. Welcome to Zanis News. To be with you, my name is Trust Bemba. The headlines. Ward Development Committees key in actualizing decentralization. Chihuahua Tala Primary School in Eastern Province receives computer labs. Plus, government procures hospital equipment worth $480,000 US. Zanis News in detail. Chilundu Town Council Chairperson Nevas Mushindu says ward development committees are key in actualizing the centralization policy being promoted by President Hakainde Hichilema. Mr. Mushindu called on stakeholders to take keen interest in the formation of WDCs, saying they are critical in the developmental processes at the sub-district level. Here are the details.
The development of public infrastructure such as schools, rural health centers, feeder roads and crossing points remains the government's top priorities in ensuring that the people live happier lives under the expanded Constituency Development Fund, CDF, with Chirundu Town Council in Chirundu District of Southern Province ranking among the best performers in the successful implementation of the 2023 CDF allocation. The local authority is wary of complacency.
Readiness for these elections that are coming, the local authority is now getting geared, prepared, and as I speak right now to you, there has been an orientation that is going on to make sure that as the elections are conducted, we move at the same pace. Because you know, at the local authority being the coordinator, we need to make sure that all these programs are prepared adequately.
In its continued quest to build on the successes addressing the challenges identified during the 2023 CDF implementation, the formation of the Ward Development Committees, WDCs, following the expiry of its second half-year's tenure, these gains still remain fragile.
And the good news again for this year, this money has gone up from 35,000 to 125, which means this is a mini CDF on its own. It is not CDF, but it's in a way, it is a mini CDF. In that, it will go to the wards and the wards, they will sit down and make proposals on how they should utilize those funds.
Anchored on the decentralization policy being fully implemented by the government, the local authority is focusing on ensuring that the sub-district level's participation is enhanced in decision-making.
So I would like to call upon the members of the community to ensure that they're part of the process from the beginning so that we can deliver the development that they desire, opposed to them not participating adequately. So that is our keen emphasis. We would want to see a situation where more members come on board and they engage with the grassroots.
Preparations are underway as the local authority has started orienting a team of facilitators and trainers of trainers who in turn will spearhead the formation of ward development committees for the remainder of the next 2.5 years.
It was that the residents in the ward have an input in decision made by the council, as in the decisions from up to pass through again the WDCs until to reach the grassroots. Stimulate and coordinate initiatives for the improvement of the environment and livelihood of the residents. The WDCs will see to it that the intended needs of the people reach the higher office so that their lives are improved in accordance to what they need as a community.
WDCs shall not assume the roles and responsibility of other institutions in operating the land. So, in communities there are a number of institutions. The traditional leadership has its own institutions, the faith, the religious sector.
Zanis reports in Chirundu District of Southern Province.
Kabuma and Masauko markets in Kanyama Ward 13 in Lusaka District will receive new market structures to be constructed using the 2024 Constituency Development Fund, CDF. Kanyama Ward 13 Development Committee Acting Secretary Saineti Hangwanama says the two markets have over 800 traders who need to be allocated a suitable trading space. Here are the details.
Kabuma Market in Kanyama Ward 13 has over 500 traders, yet it has no permanent structure. Kanyama Ward 13 Ward Development Committee Acting Secretary Zanis says the situation will soon change as construction of permanent structures at Kabuma and Masauko markets using the 2024 Constituency Development Fund allocation will commence.
Planned to put a shelter at Kabuma market, a shelter at Masauko market, and we've also planned to clear all the drainages this time under Ward 13 in the year 2024 budget.
Lusaka District Commissioner Rosa Zulu was in the area with the Muslim Social and Welfare Trust and the District Disaster Management Committee members to conduct sensitization on cholera prevention and distribute chlorine to the residents. She, however, noticed how unhygienic the marketplace is due to the stagnant water in the trading area.
There's no drainage as you just see for yourself. People are just walking in water, and I think we need the drainage system here.
Kanyama Member of Parliament Monty Jinkuli and Lusaka District Commissioner have both condemned the selling of meat products without covering in order to prevent flies from infesting the food.
It's really sad that we have also found people selling meat without covering.
But as I said, oh, you get the point. Not many.
Muslim Social and Welfare Trust Coordinator Mubashi Meta says community mindset towards hygiene is the key to winning the cholera fight.
So we hope that community is going to utilize this and learn that this bottle of chlorine might last them for a few days, but they will learn and have that education that they will be able to buy this chlorine again and chlorinate the water before drinking that water, so them and their children are safe.
In addition, Lusaka District Commissioner is optimistic that cholera will soon be eradicated in Kanyama constituency.
I pray that this is our last time to come and dish out chlorine. We'll come up with a solution which will be permanent.
Mijelo Mwemba reporting for Zanis in Lusaka.
Government has procured equipment and beds for Muyombe and Tendele hospitals in Mafinga district at a cost of 480,000 United States dollars. Mafinga Member of Parliament Robert Chabinga says government also plans to procure 2 ambulances for the district hospitals. Details in this report. Government has equipped Muyombe District Hospital Level 1 with a digital X-ray machine, ultrasound scanner and beds. The equipment, once installed, will enhance access to healthcare services for the people in the area who used to acquire X-ray and ultrasound services from Isoka and Chinsali districts in Mchinga province. Mafinga area Member of Parliament MP Robert Chabinga, who is on a continued tour of his constituents, took time to visit Muyombe District Hospital Level 1 and checked on the equipment and beds.
We have an ultrasound machine which have been bought by government at this hospital. We have the X-ray machines. No more going to Isoka. It has been bought at this hospital.
Chinga Province Health Director Dr. David Sloya further disclosed that Mafinga District will soon receive 2 ambulances to cater for the 2 health facilities.
A new ambulance and the CDF, but through his engagement, there's another ambulance coming. Meaning we have 2 ambulances for Mafinga. Our first residence section in Muyombe ever since this place was considered a sub-district last week. The issue of taking patients to Tendele has come to an end.
The MP also urged residents to utilize the services at the health facility.
Ensure that you take your children to a health facility where you can access all the medical services that are needed.
Miriam Kumwenda reporting for Zanis in Mafinga District, Mchinga Province. Still on health, residents of Sesheke districts are elated with a good number of newly constructed maternity annexes in the area. Here is a report.
Following President Hakainde Hichilema's directive and priorities as highlighted in the directive that he gave concerning maternal health and how he would like the system to enhance from 2022 to 2026, Sesheke district in Western Province has benefited from the government's will that is going around the country. District Health Director Mondo Maronad had this to say.
The maternal care, if you can tackle child care, then you are close to almost achieving your objective. Because once you sort out a child, once you sort out a mother, then you know that you have sorted out more than half of the population. And so we thank the government through the leadership of President Hakainde Hichilema for the directive and also for the effort.
Sesheke district has benefited a lot in Western Province because from the 21 facility that we have, 17 of them have been upgraded with maternity annexes. And so far, we are saying a lot of women are accessing the services for
registered nurse at Katimamulilo Urban Clinic, which was commissioned by Vice President Mtalena Lumango, had this to echo.
From the moment the annex was built for us, it has been great pleasure working here because it gives us an opportunity to attend to multiple women at the same time because it's spacious, and at the same time there's so much privacy. Even the women are comfortable as we're attending to them. Even as health workers, we are enjoying because
village indunas and their subjects are appreciating government and its cooperating partners for the beautiful built maternity annexes, which were later commissioned by Sesheke area member of parliament Honorable Romeo Kangombe.
Kakukara ngakala kufitsa bwitumiro pili kwa bayizi bali kazoli emezo faizo basipatera ba onko Africa amosho nikumwetereri wana hayalona kamsebezi tuneso kweza mwali baka 10 zalona ze mi nifitsa bwitumiro bakubona kuli bashemba luna bungata bana bapepera kwa mahai kachekufa ntwale selita baza makande
chelo itumezi abalupangezi una koluna kwa tuko ko na kupepera ni basipangira hande sina ni malumu la mangata na ni matoilets balubezi mateni mezi ni mimbete akupepera ke mingata neke mkona kuvaneke mabala halu mwakona kufumana mai space ya kupepera hande
kase sabatize muisamu yao fumani bato bakuinera mwali matoileti mashawa kaofera likaziteni.
Victor Mwala, for Zanis News, Sesheke District, Western Province.
We'll take a break. More interesting items to come. Don't go away.
Kolera wapa msongo muka. Kolera wapa msongo wa kuichisa. Mutu alina msongo wa kolera echikuichisa nga chikuma na kusaza nawa. Bize vipi mwaichisa mutu na bipoya meya nge msoji wa loso. Mubeji echikuzianga chikuma mujimba mumo ya kufumisa meya amujimba. Mubeji nawa na hase kufa mujiwola li 12 hours ngekawe chikumuhana bitumbo bya kumuka wa shiko. Unahase nga chili kwachi wa kumsongo wa kolera kuhichila mkuna meya kuwana kuhaka bitumbo nawa aze ali na majilo. Kulia byakulya na mawoko aze ali na majilo chipwe kuzachisa malonga na jindeho ja kukosa na meya majilo akuhona kuhaka bitumbo. Kulia byakulya byakuhona kufika bize bana wilie kubajiji. Kulia byakulya bituta bize kabatumbikanga kana wako. Kulia byakulya bize bana kulandulula mu mikwakwa. Na kulia na wamihako na makovu ako na kukosa kanawa. Tunahasenga chili kulikinga kumusongo wa kolera. Telekenu meya enu akunwa chipwe kuhaka mo bitumbo bya chlorine. Sanenu kumawoko enu na sopo chipwe na meya kuhaka bitumbo hanyima ya kuzaisa chimbusho. Zumisenu byakulya benu shimbukanda mubilie. Frikenu habyakulya benu byosena kuchina kubiwila kubajiji. Kanda kulya byakulya byakulanda mu mikwakwa nduma. Zachisenu chimbusho lwalo sena. Kahakanda kuzachisa ndundu chipwe mapepa andundu hakuya na kulihehwa nduma. Mwatela kumona ngwenu vipi yosena munawitapwila mchimbusho. Chimbusho chanu nawa chatela kupwa cha unyoji kahanawa cha kufika lwalo sena. Mujimbu uno banamnehela okuli bakachanda chatala kulikangula cha meno ya batu cha Ministry of Health.
Welcome back. The Mains Clinic at Chilenje Level 1 Hospital in Lusaka has continued recording an increase in the number of men seeking medical attention. Clinician in charge at the Mains Clinic, Chester Kakupa, says the number have increased from 300 to 900 per month. Mr. Kakupa says the introduction of the men's clinic has seen a significant increase of men accessing the clinic due to specialized services. Here are the details.
Men are known to shun seeking medical attention. However, the introduction of the men's clinic at various hospitals in Lusaka and across other districts countrywide has encouraged more men to seek medical services. At Chilenge Level 1 Hospital, the men's clinic has continued recording increased numbers of men patronizing the clinic to seek for the various services to over 900 per month, compared to about 300 before its establishment in 2017. Clinician at the men's clinic, Chester Kakupa, shares more.
We have a men's clinic at the Chilenge First Level Hospital, and we deal with a lot of issues ranging from erectile dysfunction, ranging from men that are having difficulties having an orgasm, ranging from prostate cancer screening. We also deal with diabetes, hypertension. We know that these diseases, they can affect a man in a lot of ways.
Some patients also shared their thoughts and the benefits of the men's clinic.
So for me, one thing that has encouraged me to come here to the hospital today is because of the male's clinic. That's sad, because I know I'm comfortably free to express how I'm feeling.
Manja hapa nachoona sisi wamuna wanzanga ndio wachitatendi kwa wamuna wanzao lekani niende niwauze bose vamene vili pamubili panga kai ni mamuna muzanga sunga yope.
Regan Mambo, a clinician, has urged men to visit the clinic.
This clinic is open to everyone, especially those people that have busy schedules. We always provide that service for them. We give appointments, so we encourage them to come to this clinic and seek that medical help they need.
Ntazanga Mumba for Zanis in Lusaka.
2 clinics have been constructed in Madido and Ngolwe wards in Chongwe district at a cost of 1.2 million kwacha using the 2023 Constituency Development Fund, CDF. Chongwe Council Town Clerk Damson Mukwato says the 2 health facilities will help cushion the long distances residents cover to access health care services. Details?
In order to take healthcare services closer to the people, the government has constructed 2 clinics in 2 wards of Chongwe district using the 2023 CDF allocation. Chongwe Municipal Council Town Clerk Dapson Mukwato inspected the project and was happy with the works done so far.
As you can see, we are almost done doing final touches. The water has been connected to the with the tank. What remaining is connection of power during the finishes. We should be handing over in the next 1 month.
Chongwe District Health Director Dr. Mwene Nseluke said the 2 facilities will offer services such as maternal and laboratory services, among others.
In a decentralized form, we are accelerating quality health improvement, bringing health as close as much as possible to the people. So the availability of this infrastructure, actually, it comes as a full package. So you have the antenatal services, which are very key in terms of reducing both maternal and neonatal mortalities in the district and, of course, across the country. Then you have also the in and out patient department. You have also the labor ward. You have the pharmacy and the small laboratory unit. The people around this Njolwe ward, they have long waited for this health facility, and I think they have tried enough, and the government has heard through CDF, we have had this facility.
And Njolwe Ward Councillor Given Mwenya and the resident expressed gratitude to the government.
We are so happy as a ward to have this clinic in our ward. Since 1964, this is the first clinic we have in this ward being built by the government. And we really appreciate the Udon government for the introduction of the CDF. Mostly they live at homes. That's a challenge. Even under 5 clinics, they stopped taking children to under 5 clinics as early as 1 year, 5 months. 1 year they stopped because of the distance.
Inende totera mkweba chibatupera ko clinic kuno kumeni udbestu. So tuwatasha sana pari chintu mugombere. Pantu mukuchura kwa situare au kaunde square panshi anguri no mwana umunono ulwarishe. No kufuire rimutware fuira munshira. So tuwatotera sana pashiri pakureka mutwaririre. Tuwatasha sana.
Barbara Chanda, reporting for Zanis in Chongwe District.
And in our education news, Chiwawatala Primary School has received 2 computer labs which are stocked with 90 digital learning tablets for learners. The project is funded by Project Luangwa at a total cost of $55,000 United States dollars. Eastern Province Minister Peter Piri officially handed over the 2 laboratories to the Ministry of Education in Mambo District. Thelma Kunda give us more in this story.
They were all filled with happiness as they witnessed the handover of 2 computer laboratories to Chiwawatala Primary School by Eastern Province Minister Peter Piri. The 2 computer labs, stocked with digital learning tablets, were funded by Project Luangwa at a cost of $55,000 United States dollars.
Investment in the education sector is critical to the attainment of sustainable socio-economic development as it contributes to the eradication of illiteracy, poverty, unemployment through knowledge and skills empowerment.
Project Luangwa also resolved to continue supplementing government effort by expanding the project to other schools in the district.
From the recent grade 7 results, 76 pupils wrote grade 7 here at Chiwawatala, and the lowest marks that they obtained in mathematics was a 90. And I am almost certain that the digital learning lessons added to this great achievement. With such results of pupils performing very, very well as they learn in the digital way using the Mwabu app and the tablets that are provided, we will be able to use this evidence to expand the digital learning to other schools within the district.
Also in attendance was Chief Mukanya.
Ndipo nuonga project Luangwa kuti kubwera kwanu mwabwera kusachitukula zona. Iyi skulu ni skulu ya kudala kwambiri. Yakuti ni skulu yamene yufunika kuti semeni ni secondary school pano. Tichitireni chifundo, tuifuna skulu kuti ikule ino.
Chris Kambewe, a pupil at Chiwawatala Primary School, equally expressed gratitude to the sponsors.
I would like also to extend my gratitude to the cooperating partner, Project Luangwa, for their involvement and willingness to undertake and complete such a project. This facility will not only add beauty to school infrastructure, but also improve the performance of learners.
Thelma Kunda for Zanis in Mambo District, Eastern Province.
Still in education news, World Vision Zambia has donated desks to Kaula Secondary School in Manyinga District in Northwestern Province. The donation is through the Gifts in Kind program.
In a bid to fortify educational resources and uplift the learning experience in Mufumba District of Northwestern Province, World Vision Zambia, through the Mufumba Manyinga cluster, under the Gifts in Kind program, has donated assorted furniture at Kashima Des Secondary and Wishmanga Primary Schools. The furniture includes 90 desks, office chairs, and tables.
We are here donating 90 desks for these learners. This comes as a way to empower our learners so that they are able to receive quality education, as well as them being comfortable as they acquire these life-changing skills. So, World Vision being a child-oriented, child-focused organization, we want to see our learners or our school-going children receiving this much needed resource in an enabling environment.
Kashima Des Secondary School head teacher Kakoma Mwinga has conveyed heartfelt appreciation to World Vision as he pledges to safeguard the items.
We are so delighted and short of words with the gesture that this organization is doing to supplement the efforts of the government. We will remain, as the community of Kashima, highly indebted to what World Vision is doing. The student chairs that have been brought to us we are going to guard them jealously and will protect. And I'm sure that will translate into quality education.
World Vision's commitment to empowering communities through education, exemplified by the donation, stands as a testament to the transformative impact achievable through collaborative efforts. As Kashima Day and Wishmanga primary schools welcome this supplementary support, it marks a pivotal moment in the ongoing journey towards providing quality education and nurturing the potential of the next generation in Mufumbwe. John Mohanga reporting for Zanis in Mufumbo District, Northwestern Province.
Side note, Choma District has recorded 2 cholera deaths while 2 patients are admitted to Choma General Hospital. We have more in this report.
Choma District has recorded 2 cholera deaths while 2 people are currently admitted at Choma General Hospital. The cumulative cholera cases stands at 13 from 26 December 2023 when the first case was reported. Briefing the media, Choma Mayor Javen Simologa called on the business community to join hands with the local authority in the fight against cholera outbreak in the district.
The 2 deaths that were recorded, one is a 66-year-old and a 2-year-old child. Since the first case, which was reported on the 26th of December, we've now had a cumulative of 13 cases in Choma. We also have 2 people currently under observation. There is enough preparedness to handle any patient before they are taken to a particular isolation center. So all the medical facilities in the district, 38 in total, are able to attend to any patient. We have written correspondence to different business houses asking them to take part in the cholera fight.
Choma District Commissioner Gamera Segaria wants residents to stop gathering during funerals.
Like in case of funerals, we find that people will be in one place for 2, 3, 4 days. You know, we have to understand what cholera is. Maybe 20 people are sharing one toilet. So, which means that the chances of contracting cholera are high. Because high density areas in town are the most important.
Choma District Health Director Dr. Musa Mansa says his ministry is enforcing Statutory Instrument number 79 of 2024 on cholera.
In cases of an epidemic, we have SI 79, which has also been a new clause that has been added for 2024. There is robust legislature that is available for utilization during an epidemic, which is what is being enforced at the moment.
Gift Banji, Zanis, Choma, Southern Province.
Well, that item brings us to the end of our news, but before we go, a recap of the stories that made headlines. Ward Development Committee's key in actualizing decentralization. Chihuahuantala Primary School in Eastern Province receives computer lab. Plus, government procures hospital equipment worth $480,000 US. Well, viewers, that's all we packaged for you from our news desk. On behalf of the entire Zanis production team, I've been your presenter, Trust Member. It's goodbye for now.